and we will get started with week 2. Welcome everyone to week 2. We have a few different presenters for you today, and then we're going to open up for a Q&A session. And before I hand it off to Satish for introductions, I'll just make a few housekeeping announcements. First of all, grades have been posted for week 1. So your discussion forum grades, as well as the grade for the entrance survey, if you took that, should all be in your grade book. And the place that you go to see that is your progress tab. Let's see if I have it open here. This progress tab here. Those will show you your grades so far. So yours should look something like mine, where you've done your survey and your first discussion. And after week 2, the second discussion will be graded. In addition, we've been sending out emails on either Monday or Tuesday of every week. And so if you don't receive emails, let me know. You can chat me. You can do a private chat in this web conference here. You can email me afterwards, but let me know if you're not receiving those emails. I can look into that for you. And with that, I will send it over to Satish to introduce the week as well, and then introduce our first speaker, Dr. Carlene Radix.
Thank you very much, John, and welcome everyone to week 2. And as I thank John, we can all appreciate that John is literally under the weather, as he is experiencing some of the aspects of our course, looking at variations and extremities of climatic conditions and how it impacts health.
Yes,
and
especially in New England climatic conditions.
Okay, so we very much like to live our course experiences all at the same time. But thank you, John, for as always, leading and building and delivering the course for us, as John is our technology guru for our open access courses here at St. George's University. And today we're actually very excited to continue the discussion from week 1, which began with a discussion on climate and the understanding from a global perspective, different variations, determinants. And in fact, in your discussion forum for week 1, what we appreciate is that regardless from wherever we belong to, and we belong to all regions of the world as a global course community, we all share and appreciate the fact that not only is the weather changing, which is normal, but the extremity, the severity, the frequency, that is of particular concern. And the concern lies not only in terms of the actual climatic conditions, but the implications that have to our health and well-being as well. And that's where we are continuing the conversation into week 2, as we discuss the issue of health and disease resulting from, attributed to, the factors associated with the climate itself. Today we have 3 colleagues, 3 experts in their field representing issues of health and disease and connections with climate change. And we will begin with Dr. Carlene Radix. And Dr. Carlene Radix is a public health physician and a health administrator who's actually very much actively involved in the Caribbean region as a leader in, generally speaking, on health issues, where she currently holds the position of the head of health at the Organization of Eastern Caribbean States, which represents one of the sub-regions within the Caribbean region. And in this position, she holds strategic cooperation initiatives for member states on the issue of health. And as her position dictates as well, health goes beyond just the physical, mental, and social well-being, but also has other implications in terms of the environment, in terms of economic issues, in terms of population-based considerations as well. So we'd like to welcome Dr. Carlene Radix for joining us. And Dr. Radix is actually joining us while she's also mobile. So we appreciate the commitment that we all share as part of our course. So Dr. Radix, so over to you, and thank you for joining us.
Thank you, Dr. Bidesi. Are you hearing me well?
I can hear you clearly.
Sound is all great. Thank you, and welcome to everyone to week 2 of this fabulous course that St. George's University is putting on. Also my alma mater. I am a graduate of St. George's University. And I'm happy to be part of today's panel. I'm just going to present orally for about 10 minutes and speak a bit to climate and resilient health systems. So, and I'm hoping, Satish, that you'll keep me in check or John in terms of time? I'll just chat for about 10 minutes or so, but keep me in check so I don't go over.
Sure thing.
Great. So as has been said, my current position is as head of health at the Organization of Eastern Caribbean States. And let me just take a moment to tell you what the Organization of Eastern Caribbean States is and who our member states are. So the Organization of Eastern Caribbean States, which began in 1981, is a political and somewhat economic grouping of Caribbean states. And if you know anything about the map of the Caribbean, our member states start from Grenada in the south, where you guys are in St. George's University, and move up to British Virgin Islands in the north. And excepting for Barbados, which is a bit outside of the chain, basically the member states are along that chain. We have 6 independent countries, 4 UK territories, and 2 French departments that are along that chain that are members of the OECS. And so we focus on what can be done best together here in the at the OECS Health Unit. And as you know, our region is very prone to extreme weather events, extreme events due to climate. Certainly, we have the experience of Dorian just this season with the Bahamas. We've had Irma and Maria hit in 2017. Along the way, we have, so I am currently in St. Lucia. Yesterday, we had flash floods, which were unpredicted based on extreme rains. And all of these events have effects on health. And I'm sure you have gone through some of these in week 1. But the effects are wide-reaching, including because changes in climate affect air pollution, they affect water, they affect, if you have natural disasters, they actually affect health due to injuries. And so there's a wide range of issues that can be affected. So what I wanted to touch on is resilient health systems, because one of the things that we need in terms of addressing climate change and health is to address resilience in health. And resilience in health systems, this is a kind of new term that's being used. When I say new, within the last 5 years or so, and really associated with the Ebola outbreak, the large Ebola outbreak, not happening currently, but the previous outbreak happening in West Africa. Which highlighted the fact that the health systems are not resilient. They're not able to respond to emergencies, and they're not able to keep up with what they need to do all the time. So that brings me to the definition of resilience. What is resilience? And I think, I don't know if we have any civil engineers or mechanical engineers, there are graphs and things that people talk about with regards to resilience. I don't have the technicalities, but I like to think of it like a rubber band. So if a system is resilient, it's able to absorb, to do what it's supposed to do, and absorb additional stress. So if you have a rubber band and it's just sitting there doing what it usually does without additional stress, fine. When you add stress to the rubber band, it's able to stretch, to absorb the stretch, to absorb the stress, but then it's able to come back to what it needs to be. If the stress is too much, it can push the rubber band beyond what it can do, and it's not able to revert back, or it can break. So when we have extreme events, which may include increases in asthma attacks, it may include increases in heat stroke, at the time of a hurricane, it include injuries, etc., the health system becomes more stressed. So in addition to all the things that we have to deal with, the usual levels of disease, there is an additional level of disease that the system needs to be able to stretch to accommodate. And if it's able to absorb this stress and then be able to come back into place, then it's resilient. Some extreme weather events are so stressful that they permanently change our system. So you may have, if you think about materials that are ductile, you can stretch the system and you stretch it and then it remains permanently changed as a result of what's happening around us. So these are just two concepts that I wanted to float out there, the fact of health system resilience. And what does it take for health systems to be resilient in our context of small island developing states? It really means having the capacity to adapt, to absorb, adapt, and transform systems as needed according to the stress. And this can be done by looking at the 6 building blocks of health systems. You need to be looking at the supply chain, medicines, medical technology, human resources, governance and leadership to be able to adapt and transform systems, as well as the ability to deliver services, ongoing services, as well as respond to the shock, whatever the shock is to the system. So the main, and so how can we do that? How can we build resilient systems? Part of it has to do with the infrastructure, building resilient infrastructure. Part of it has to do with being able to have surge capacity in terms of human resource to respond to events. But a lot of it has to do with being able to have adaptive systems that are able to adopt new ways of doing business in the face of climate change. So I think I'm going to leave it there in terms of that concept. I'm not sure how I'm doing for time.
You're at about 7 or 8 minutes, so wherever you feel comfortable leaving it.
So I think I'll leave it there in terms of a concept, and I'm hoping that these thoughts will generate some discussion and questions as we move forward.
Thank you very much, Dr. Radix, for that as well. And what we appreciate in particular is the concept of the small island developing state. In fact, when we think about small island developing states, they comprise almost 1/4 of the countries in this world. So from a proportion of countries within the context of the world, small island developing states actually represent a significant part of that as well. And also in terms of the population, the population itself, of course, is much smaller, proportionately speaking. But it's the numbers of countries, it's a particular critical issue as well. So we appreciate the context of small island developing states. The issue of health resilience as well is another issue in terms of the finances and the resources that's required to adapt and adjust to the resilient systems. So Dr. Radix, if you can probably just, from the OECS perspective, if you could just share with us what are the challenges, the limitations for OECS countries from a fiscal perspective, from a resource-based perspective, to move towards the direction of resilience for health systems. We may have lost Dr. Radix, but what we can do is stick a pin on that point at this particular point in time, and we will continue the discussion. And moving from St. Lucia in the middle of the Caribbean, we'll be moving up north to the Bahamas. And in fact, we're moving from one vulnerable region to another as well. And in fact, it's based on most recent experiences with Hurricane Dorian, which impacted the Bahamas. And for that particular perspective, we have with us Phillip Weech. And Phillip Weech is currently the Assistant Vice President for Research and Grants at the University of Bahamas, which is located in Bahamas itself, and have significant experience working in different aspects on this issue of climate and health. For example, Phillip within the context of the Bahamas Environment, Science and Technology Commission, also within National Energy Policy Committees, which are critical areas or of need and focus as we address climate and health issues, as well as the officer in charge and the point person for the Global Environmental Fund and the United Nations Framework Convention on Climate Change for Bahamas, and of course located in Bonn in Germany as well. So we welcome Phillip to our panel of our course team and to share with us his experiences and his perspective on this particular topic. Phillip, thank you and welcome.
Thank you very much, Satish, and good afternoon to all of you, and hello from the Commonwealth of the Bahamas. I'm coming at this from a slightly different perspective, so forgive me if I take the liberty of guiding discussion slightly differently from what was had. By way of discussion, let me remind all of you that the Commonwealth of the Bahamas is about the same size of the entire Lesser Antilles, from the U.S. Virgin Islands all the way down to Trinidad and Tobago and Venezuela at the end. We're 1,000 miles from end to end, and we're 100,000 square miles of ocean, and we're right next to the United States. Within the Caribbean, there's a discussion sometimes as to whether we're a member of the Caribbean or not, but we normally have that discussion over beer. I'm going to open some slides here, so if I don't get this right, someone is going to help me with this one.
Yeah, just look for that green share button. It should be with all the face tiles.
Share button, okay.
Yeah, and then it'll give you an option to share your desktop, and you say,
I see it's red again. I got the share button. Okay, share button is one, and I'm going to go first and foremost to the slide presentation.
Perfect.
What I provided for you essentially is a list of different links that covers different topics related to climate change and health. Crime and violence is one of them. It talks about violent crime and heat waves, and it gives you an example of some of the stories that's already available on the internet that you can take a look at. And in particular, it talks about the issue of being hot and bothered and the fact that heat affects violence. It talks about how Chicago, as a city in the United States, took particular action during a heat wave to try to reduce the amount of lives lost. And the other one is one that talks about violent crime and studies in the rates in the Caribbean region itself, which is one of the highest, some of the highest rates in the world. And the Bahamas also fits into this entire scenario. The next one talks about heat and diabetes. It again is a point taken that vulnerable persons, as the heat waves occur, find themselves particularly challenged because, especially in diabetes, you're not able to control your heat, and that affects your overall ability. The other one is a whole issue of heat stress and how do you actually identify heat stress in individuals. And as all of you are doctors or soon to be doctors, these are some of the things that you're going to be presented with in the course of your careers. The other one I have indicated is the third slide is the one that deals with natural disasters, its frequency, and some of the practical reactions that come as a result of, for example, in the case of Hurricane Dorian, which has just visited the Little Bahama Bank and did massive damage in both Abaco and Grand Bahama, which represents the second and third largest pillars of our economy. And also the other one deals with unanticipated impact, that is the effects of oil spill when you have a facility that essentially fails during a major storm and you have a large release of hydrocarbons into the environment, and what therefore represent the long-term effects of that. That's the reason for giving you these slides or these references. The particular point I want to make is that I want to remind you, climate change is a reality to be all faced. That's first and foremost. It's not a situation where there's only small island developing states have to deal with it, but all countries have to deal with it. Sea level rise is a reality that we all face. And it doesn't matter whether you're living in Florida or your per capita income is very high. Sweden, the Netherlands, all countries will have to deal with some of these consequences of climate change. The other thing I want you to also remember is that there is a point where, and this is what science tells us, that if we're not careful, we will go over the precipice. We will hit a tipping point, and the world will be radically different from what it was in our lifetime and our parents' lifetime. So that's an overall context I want to make sure you understand. I don't think there is any of us on this call will question whether or not climate change is a reality or not. From the position of small island development states, it is a reality, and that's what we have been dealing with in negotiations for many years. And so I want to again remind you that from the perspective of many of us, it is not a question of if, it is happening now. The last slide I'm putting up is one that speaks to non-communicable diseases in the context of the Bahamas. And this is a slide for submission that was given in 2016. And it talks about all of the various NCDs, the percentage. And I draw attention to a couple of these things. For example, in the very first top of the slide, you see that with regards to NCDs, some 75% of deaths in the Bahamas can be attributed to NCDs. And that deals with cardiovasculars, cancers, chronic respiratory disease, diabetes, the issues dealing with communicable, parental, perinatal, and non-nutritional conditions also exist in the Bahamas. So even though we may represent a high per capita income, some of the realities of who we are shows up in statistics like this, because we also have a very large migrant population that fits into our overall statistics in terms of what it means and these numbers as they present themselves. So not only are we talking about the situation of Bahamians, but we're also talking about the many guests that are within our midst. The death toll, for example, with regards to what has happened in the Bahamas as a result of Dorian, we usually do not have Bahamians die because we have a very good early warning systems, and we take hurricanes seriously, and we also ensure that we are well protected in terms of our homes, our residences. But we're now seeing for the very first time within the Bahamas a death toll that's orders of magnitude higher than we've seen before. And a lot of that has to do with the fact that many of the persons who have died lived in conditions that would not be considered ideal in any country, and particularly in the Bahamas. The other feature that you see here with regard to looking at these statistics, of course, is that this is a picture, a snapshot of the Bahamas and its health status in 2016. And if you look, for example, at the numbers of obesity, for example, in adolescents between the age of 10 to 19, you have the percentage in the Bahamas is as high as, it's on average about 16 to 20%, depending on how these numbers are figured. So the youth of today in the Bahamas and throughout the Caribbean are heavier than, they have already existing preconditions. They have issues with physical inactivity. They have issues with regards to alcohol consumption, salt intake, tobacco, raised blood pressure, raised glucose levels, and all the things associated therefore. And this is the populations that we will all deal with in the future. And health systems have to respond to these populations into the future, upon which you add the stresses related to climate change. So for all of you in looking at this issue, this is painting a picture of what the future will look like by several orders of magnitude, because again, the science is telling us is not only that we're dealing with extreme events, but we're also dealing with a fundamentally changed climate system, which means that mean surface temperatures across the world will rise, not only nighttime, but also daytime temperatures. It also means that we will have to deal with the stress associated with the loss of lives. Again, I draw the point with regards to Dorian. We have had in our history, in the last 100 years, storms that have washed people away. But in today's experience, we have had people who are alive today who had mothers, fathers, sisters, and brothers who they have tried to pull in from a storm or from surge and have not been successful. So the tendency always is to, the storm is past, the threat is over, we got back to normal business. But persons who dealt with the mental health stress associated with that and the uncertainty, those realities continue well into the rest of their lives. And so that mental health issues, for example, we tend to deal with in triage by rapid response, by providing support services in the short term. But we're now talking about a reality where those services need to be provided in a much longer term. The comment was made by our colleague about the resiliency of health systems. And the Bahamas has its health system replicated across all of our major islands. So we have 30 international airports, we have 30 clinics, we have 3 main hospitals, we have clinics that exist. The case in point to what happened to the clinic in Abaco and the hospital in Grand Bahama. They were subject to storm surge. They were subject to persons living in them for periods longer than they were normally designed to hold. And both of them have suffered significant losses to the extent that in Grand Bahama at the moment, there is still a portable hospital that's operating to provide essential services to residents in Grand Bahama. And that's almost unheard of in our history. So we are seeing changes that in our lifetime we would never have anticipated. And this in many regards is the future as it will be into the future. Again, the very last portion of the slide I have up, which deals with NCDs, it talks about the projections in past trends and projected linear terms, as well as global targets as it relates to the issues of blood pressure, smoking, and obesity. And as you can see, without interventions, without changes taking place, the linear trends you're seeing, for example, in obesity, will continue to the point where population, male and female in the Bahamas, will be between 30 and 45% by the year 2025. So that's the trends going forward. So for all of you, the message, of course, is that it's not only about what we see happening in the short term, it's also about the long-term effects that you have to deal with. And with that, Satish, I would like to stop because I don't know if I've used my 10 minutes, but I've said everything I think I need to say at this particular point.
Thank you very much, Philip. We appreciate your sharing of the Bahamas perspective and also bringing to the fore health concerns that are environmental, but also chronic as well. And making mention to the communicable aspect. And we will certainly engage our participants with your topics soon. But before we do that, we will now switch over to Dr. Melisa Shah. And Dr. Melisa Shah actually comes to us in this course from Stanford University. And St. George's University has a long-standing relationship with Stanford University, especially in terms of research and engagement on the broad topic of vector-borne diseases, but more specifically on some of the Caribbean outbreaks with regards to chikungunya and Zika virus as well. So Melisa is part of that team, and Melissa's presentation will focus on the interactions, the influences of climate on the vectors for these diseases that we are focusing on, and of course the diseases themselves as well. So we welcome Melisa, who is currently a postdoctoral fellow in pediatric translational medicine and an infectious disease fellow at Stanford University as well. Dr. Melisa Shah, thank you for joining us, and over to you.
Thank you so much for having me today. It's an honor to be here with Dr. Radix and Dr. Weech and to be with you all. Let me get my slides up here. Second. Sorry, I'm just looking for my slides.
Take your time, yeah, but you're looking, okay, you got them?
I see it, yep.
There they are, yeah, we see what you see.
Okay,
Perfect.
great. Yes, thank you again. So for the next 15 minutes or so, I wanted to go through and give you a glimpse of some of the topics that we have been working on here in the Labode laboratory. Our interests are really in arbovirology. I also work in the malaria space, and we've been interested in understanding how climate change specifically will impact the incidence and projections for arboviruses and malaria, in specifically looking in our cohorts in Kenya. So my objectives today were to identify some mechanisms by which climate change can promote the emergence of vector-borne diseases, and also to illustrate the association of temperature change on the risk of malaria and dengue in Kenya. So as you know, there's many different types of vectors. Vectors are living organisms that can transmit infectious diseases between humans or from animals to humans, and many of these vectors are blood-sucking insects. Of all the vectors, probably the most important vector for human disease is the lowly mosquito, which I'll be focusing on today. All of these vectors are intrinsically temperature dependent. They're ectotherms. So you can imagine that the propensity to transmit infection is also temperature dependent. This is a great schematic I saw in the Washington Post recently, and it basically goes through the 5-year average temperature changes compared with the late 1880s, and areas in red are where temperatures have increased more than 2 degrees Celsius. And you can see that, roughly 1/10 of the globe has already warmed by 2 degrees. And this is thought to be an important sort of threshold after which you'll see severe climate effects. As the other discussants of ours already noted, that climate change is related to the increase in extreme weather. So extreme weather events are thought to be more frequent. In Kenya, where we work, anecdotally, we've noticed that there's been increased droughts, there's more flooding, there's disruptions of agriculture, and these climatic changes can have a major effect on disease transmission directly and by how they affect human behavior. This is a schematic to help develop a framework for understanding the important environmental inputs that determine disease incidence. On the top, we start with the hosts, going all the way down to the vectors and the vector competence, and finally to how susceptible is a host. And all of these things come together to determine disease incidence. And the environmental drivers you can see on the left here include climate change and how climate change affects temperature, humidity, and rainfall, as well as land use change. So as we think about that framework, I will say that the link between climate change and infectious diseases is very complex, and it's poorly understood. We're beginning to understand some of these relationships. And I'll give you an example of the story of chikungunya in Kenya. Chikungunya is very important emerging disease, particularly in island populations. In Kenya, it was first recognized in the 1950s. There was an outbreak in the 1970s, and then there was no cases until 2004. And after 2004, it was a very important outbreak there. It was thought that this was the outbreak that actually sparked the spread through the Indian Ocean, infecting nearly entire populations of islanders on La Réunion and the Seychelles. And so climatologists went to sort of understand what propelled that 2004 outbreak. And what they noticed was that in the months preceding that large chikungunya outbreak, there was a major drought. There was a major drought in that area of Kenya. And given that we know that mosquitoes are dependent on water sources, this was a peculiar sort of finding. And so when they dug more closely, they realized that the drought caused changes in human behavior. So people were less likely to change their water cans that they had around their house. And there was probably more standing water that may have led to this outbreak of chikungunya virus in Kenya. And there's a reference there if you're interested in learning. So as you can see, by climate change in this case affected disease incidence, but not directly, but more so by altering human behavior. So in order to sort of start unscrambling the story of climate change and mosquito-borne diseases, it's important to sort of understand the differences in mosquito species. So I've laid out the three major species of mosquitoes. Aedes mosquitoes are responsible for chikungunya and dengue and other arboviruses. Anopheles mosquitoes are night biters that transmit malaria. And of course, you have the Culex mosquitoes that transmit many of the encephalitis viruses. There's another important difference between these three mosquitoes that sort of underpins our research here. And that is that they have different optimal temperature ranges at which they perform and infect and function. So knowing that information, our work here sort of uses a mechanistic trait-based framework, looking at the physiology of mosquitoes to understand how temperature impacts disease spread as measured by reproductive number. So for vector-borne diseases, we try to understand what are the host and parasite traits that determine the value of R naught. And R naught is the average number of new infections from a single infected person. And you can sort of think about it as for human-to-human disease, sort of the contagiousness, but for a mosquito-to-human disease, sort of like how transmissible it is. And so we don't need to go into this math, but there have been proposed sort of reproductive numbers for vector-borne diseases, and these take into account many different traits of the mosquito and the parasite that are temperature dependent. And I'll briefly sort of delve into this a little bit. When you think about the adult mosquito starting at the egg stage and the larva stage and the pupa stage, all of these transitions in the cycle depend on temperature, and you can measure the effect of temperature on each of these traits of the mosquito. Similarly, temperature affects the biting rate, the rate at which mosquitoes bite humans, and finally, temperature, ambient temperature determines how the parasite is able to develop within the mosquito and transmit disease to the next host. So based on this framework, we asked the question, how will climate change affect vector-borne transmission? In the past, many years ago, people sort of felt that as temperatures warm, the risk of malaria and other diseases would increase. And this is a projection in 2000 that suggested that climate change would actually increase malaria transmission, you can see in red, over 2 times the levels by 2020. We're almost at 2020, and you can imagine that this hasn't borne out. We've seen less malaria. We haven't seen malaria in these European areas that they predicted. So why is this? To better understand this, you can think about mosquito physiology as a sort of as a bell-shaped curve. Many prior models thought that the trait performances, the performance of the mosquitoes, increased linearly. But we know now that all of these traits are actually unimodal. So you may see increased biting up to a certain temperature, after which the biting rate would decrease. And this is similar this is seen in most mosquito-borne traits. So using those different mosquito traits, Erin Mordecai and some of our other colleagues here at Stanford developed a new estimate for the peak temperature at which malaria would be transmitted. So in red here on the right graphic, you can see previous estimates that predicted that malaria would peak at around 30 degrees Celsius. But when we looked at the mosquito traits in a unimodal curve rather than a linear curve, we realized that actually malaria will peak at much lower temperatures than previously recognized, and they predicted that at around 25 degrees, malaria would have the greatest amount of transmission. And this was validated by some field studies, but not human studies. And you can use this same approach for other vector-borne diseases, including dengue fever, Zika, chikungunya virus, West Nile virus, because each of these are transmitted by different types of mosquitoes. So in green, you can see that the malaria curve peaks around 25 degrees, whereas dengue and Zika, which are transmitted by Aedes mosquitoes, not Anopheles mosquitoes, the peak transmission occurs closer to 30 degrees Celsius. And you can imagine how that would really impact how you would predict climate change will affect the emergence of these diseases. So my work particularly looked at how this temperature effect, this peak at 25 degrees for malaria, whether it was can be confirmed by clinical human malaria incidents in Kenya. So we study malaria and dengue virus in 4 outpatient sites in Kenya, 2 on the coast and 2 on the west. And we had about 5,000 people enrolled in this initial study. And on the left, I'll take you to this graphic looking at the mean daily temperatures at our 4 sites by year. And you can see that the top 2 differ from the bottom 2 in that the coastal temperatures are higher than the western temperatures in Kenya. And this was important because we could use this data to help understand how transmission of malaria also differed based on temperature. So we plotted the malaria smear positivity. So that's the risk of having malaria when you come to a clinic visit over temperature. On the x-axis is temperature, and on the y-axis is the malaria smear positivity, and on the second y-axis is the relative R0. So this is what the black line is what we predict. What we would predict for malaria transmission based on our prior model. And the dots indicate what our actual patient data shows. So as you can see, as you get closer to 25 degrees, we're seeing greater malaria transmission. And as we move closer to 30 degrees and warmer, you're seeing lower and lower amounts of malaria transmission in our actual pediatric population. And we looked at this further by controlling for rainfall, and other factors. And again, we saw a peak around 25 degrees. So the reason I bring this up is because this has major implications for climate change and transmission of malaria. For example, you can imagine a place that starts around 22 degrees Celsius and the temperature rises by 2 degrees Celsius, which is what is happening with climate change. You can see that the risk of malaria on that black line goes up significantly. But if you start at a place that was at 25 degrees and you move to 27 degrees, you can see that there might be no change in the effect of temperature on malaria transmission. And conversely, if you move into an area that's starting at like 27 degrees and you move up to 31 degrees, you can see that in those areas, you might see a decline in malaria transmission. And I want to show you one more sort of graphic looking at this a little more closely. So in yellow, we plotted the reproductive number curve for malaria, and then the yellow dots indicate the patient data. And in red, we plotted the reproductive number curve for dengue virus, based on the Aedes aegypti mosquito traits. And you see that the non-malarial febrile illness seems to peak at higher temperatures than the malarial febrile illness, which also confirms our suspicion that, as temperature changes, you'll see a difference in the transmission of malaria as well as in arboviruses. So based on these studies, Sadie Ryan and others predicted that that climate change will actually shift the burden of malaria. So in areas that previously maybe didn't have malaria, they may be warming to temperatures where they would develop higher transmission of malaria, whereas areas that are already close to that thermal optimum of 25 degrees, as you get warmer, they may actually see less malaria. And this graphic shows predictions based on temperature change for malaria transmission in 2020, 2050, and 2080. In areas in red are hotspots for malaria. And you see that those are shifting towards highland regions of East Africa, where the temperatures are currently cooler, and also south towards the Albertine Rift. Similarly, when you do virus that is where the hotspots are in West Africa are shifting eastwards and southwards, and we're seeing the spread, a predicted spread of dengue virus through Africa. So just a few final thoughts. I just wanted to sort of make the point that we feel that climate places limits on vector-borne disease transmission, and there's many unanswered questions. We don't know whether mosquitoes will adapt to warming temperatures, and I think the most important thing is that climate change will change disease transmission in a nuanced way. It won't be the same in every geographical location, and it will depend on the current temperature and climatic features. And finally, we predict that temperature rise may lead to a shift from malaria to arboviruses in Africa. So thank you so much for your attention, and yeah, I look forward to discussing more with you.
Thank you very much, Melissa, and thank you for sharing the presentation. I believe this presentation is quite instructive, especially in terms of establishing the link between climate and health. One of the concerns that at least I recognized in week one, persons who are in healthcare professionals, they are even struggling with establishing the link between climate and health. In fact, last week, we learned from our colleagues at the United Nations that in the global conversation on climate change, healthcare workers represent 1/4 of 1% of the stakeholders at the table present discussing this issue. So healthcare workers need to take more ownership, need to build more awareness, and the link between climate and health should emphasize and provide that confidence and opportunity to participate and be involved in this discussion as well. So thank you very much, Melissa, and thank you, Phillip, and thank you, Carlene, as well for sharing these different perspectives. We would like to open up the opportunity now for our course community. Share with us your questions, your comments. It's all interactive from here on in, after receiving feedback and presentations and perspectives from our colleagues. So feel free to send in your questions, and we will certainly be addressing them within the context, of course, of time as well.
Yeah, thanks, Satish. There's two ways as a reminder to send in questions. One is you can chat them into the chat box, and I will present them to one or all of our speakers. And secondly, you can use either the raise hand icon, which you can find in the participants tab, or there's a couple different icons that you can see in the participants tab, including yes or so use any of those, anything you can find to give a little alert, and I will call on you, and you can come on with your microphone and ask a question. So I have a couple questions via email, and then I actually wanted to start with one for Dr. Weech. And the question is that, this is our second week now. This is the second time we've heard of this relationship between heat and violence. And so I kind of wanted to know more about what that relationship looks like. Is it linear? With every degree of heat, there is an increase in violence? Is there a magic number? And then I also want to know what Chicago does to address heat and violence. Do they address the heat? Do they address the violence? So two-part question for you. Thank you.
No, thank you very much for the question. The article I sent makes reference to studies that were done with regards to heat and violence, and I would encourage the participants to go and actually read the study. There does not appear to be a linear relationship of one to the other. And heat and violence is an issue that does not just affect any one particular age group. It deals with heat and violence across the entire spectrum, including violence that would take place or that would be had against even children. So it is the general level of discomfort and the fact that more and more persons are not able to control their emotions and find themselves in confrontational situations that happen. So no, it is not temperature related, it's not age related. In the case of what was done in Chicago and what was done in other places in the world, you create safe places where you're able to provide residents who are least able to afford it a temperature controlled environment, so they're out of the heat and the bother, and they're now living in a place where that particular stressor does not exist or is limited, or or is provided at the times in which the temperature spikes at the highest possible time. And that has proven to be one that has reduced the violence and has lessened. The other preventative measure that is referred to in the article in Chicago is the fact that the police chief sent his deputies out essentially to take into custody persons who are known to be particularly violent, or the gangbangers, or whatever you call them, in order to act in a preventative way to make sure that those actions doesn't lead to additional death during a period of time. We lived in Germany for a period of time when Germany went through, or Europe went through one of its more recent heat waves. At that time, the death toll, for example, in I think it was in France, it would happen in August when most persons were at the beach, except for those people who couldn't afford to, the elderly, and those who normally would not go to the beach during those months. And because there's a lack of facilities, air conditioning facilities, they found themselves trapped in buildings, not able to get the rehydration fluids they need. So it is not an issue that is only limited by one's wealth or one's location. It covers the entire globe. Even in the Bahamas, for example, we tell the story that in the middle of a supposed crime wave in the Bahamas, when the power went off, persons who were afraid of the crime wave found themselves in cars on the public beaches with their windows down, because that was the only opportunity you have with the power being off to be able to have some cool air moving across during the cool view. So the responses to it is appropriate to the circumstances. But in the case of what has happened in Chicago or throughout Europe, they're now taking proactive measures when the heat levels reach to a certain point, or it persists for such a long period of time, of trying to provide for persons that safe, comfortable environment, so they are not, that condition is not exacerbated.
Thank you. All right, the next question comes from Ruth, and I'm going to direct this one to Dr. Shah first. And the question is that vector-borne diseases such as dengue, chikungunya, etc., are fairly predictable and therefore should be more controllable. How can countries more effectively use climate data to limit or prevent them before they become national epidemics? And are there any success cases?
Hi, yes, great question. I think, with the rise in chikungunya outbreaks as well as dengue outbreaks worldwide, they say that up to 40% of the population of the world is living in areas with active dengue transmission. Certainly a very important issue. I think we actually have to start from the very beginning, in that diagnostics for many of these arboviruses are very, very poor. They're not accurate. There's no point of care testing. The highly sensitive molecular assays are expensive and they take time. So I think a focus on diagnostics initially is one of the most important things that can happen in this field. And secondly, there needs to be more surveillance. I think as diseases spread into naive populations and new geographical areas, we need more robust surveillance systems, simply to document the burden of these diseases, understanding the phylogenetics of them so that you can see how diseases are being spread. Those things will inform disease control efforts. And finally, climate change, I think there's actually a role for using climate our group has started doing these sort of analyses where we put in temperature, humidity, and rainfall inputs, and we're able to actually predict vector abundance pretty well, and also human cases. And I think more work towards there will allow climate data to help inform public health efforts and understanding when outbreaks are going to happen.
Super, thank you. Dr. Radix, are you back with us?
Over to you, Satish. Yes, I haven't left you. I've been listening in.
Okay, excellent. All right. I'll give the next question to you. The question is from Jan. It's a two-part question. The question is, what are the metrics for measuring resilience relative to the impacts of climate change on health? And then the second part is, can someone elaborate on the relation of resilience and adaptation?
Okay, so these are very good questions, and there have been several frameworks proposed for measuring resilience in health systems. It certainly isn't a exact science. So there have been some frameworks that have been used. There's been a framework that was used to assess health system resilience to economic crisis in Ireland, in which they basically looked at three different aspects: the financial resilience, adaptive resilience, and transformatory resilience. Financial resilience, the things they looked at included protection of overall levels of funding for health, protection of health funding compared to overall economic decline, and protection of service provision over administration, and protection of vulnerable groups in terms of entitlements and funding. And in terms of adaptive resilience, looking at things like reduction in unit costs, the ability of the system to sort of increase the surge, increase in system productivity, and reduction in staffing without reduction in service, as some of the things that they looked at in terms of adaptive resilience. And then, of course, in terms of transformatory resilience, looking at really reforms around clear reforms and policies as a result of the economic shock at the time. Similarly, we see similar systems following the Ebola outbreak, looking at systems around how systems adapt, how operations improve or change around the shock that affects the health system, how aware the system is to vulnerabilities, if the system is able to self-regulate, and how integrated the system is, as well as diversity. This is another framework, a proposed framework for or a resilience index that is used. I'm not sure if that answers both questions.
Yeah, and you can type in whether it answers both questions for you, or anyone can follow up. You know, I can ask them as a follow-up. I will move on to the next one, presuming that they've been addressed. And the next one, I'm not sure who should get this question first. I'll just give it to everyone. Maybe I'll ask Dr. Weech first, and it is there any linkage between climate change and an increase in asthma patients? So I'll turn to Dr. Weech first, and you feel free to pass it along if you'd like.
Okay, first of all, let me. I'm not a doctor. My expertise is in hydrology and water resources, but I've been working in the climate change field now for too many years for me to even remember. The question, let me see if I can answer it again a different way. And what was it again? What was the question? What?
Is there a linkage between climate change and an increase in asthma patients?
I'm going to make reference to discussions we've had with all public health officials here in the Bahamas as a result of what is seen in the public emergency. And I think Dr. Radix, this is probably common throughout the entire Caribbean. When you look at non-communicable diseases, again, our statistics, you'll see that a significant portion of young people are also affected by asthma, and heat stress manifests itself in that in most cases we're seeing most of those individuals in the public facilities at the hottest time during the year, and particularly at night, and particularly when the set of circumstances is such. And this is where you're seeing trends that are linked to temperature and linked to circumstances. So if it gets extremely hot and extremely uncomfortable, predisposed conditions are triggered, and persons then end up looking for that relief, either through medications or finding themselves going into facilities where at least one of their parameters is being moderated by, and that's one of temperature. So in the events and the occasions that I have been in the public health services or the public hospital here in Nassau, when this happens, you will find that the entire facility, the emergency room, is filled with persons, primarily those under 10 years old and their parents who are trying to seek relief at the same point in time. And I guess that's more antithetical than anything else. The problem I think we have throughout our region, but I can say specifically in the Bahamas, is that a lot of these things that are taking place are not necessarily being identified in the link that it is health, or it is climate. It is health, yes, but the issue between that and climate is not something that is well defined in the region as it could be, or as it should be. Reference is made by Melisa with regards to the work on dengue fever. There was a study done in Barbados several years ago that looked at the conditions, the preceding conditions that led to occurrences of dengue within Barbados. And there is a link to rainfall, there is a link to temperature, and there is a link to the persons appearing in a healthcare facility based on the preceding conditions. So there are links that give you the indication. Now, whether or not we're actually using those in a preventive manner or not, as in the case of what the police chief did in Chicago, is questionable. And again, this also speaks to the fact that some of the studies that we need to do across our region to identify these conditions and to take responsive actions may not be at the point that we would be, all of us are comfortable with. And also the reporting of it in terms of advising the necessary policymakers may also not be something we would like to see happen.
Wow. So what I'm hearing from all that is that there's a lot of there's still ways to go with making these linkages between climate and health in a lot of cases. Is there anyone else, Dr. Shah, Dr. Radix, that wants to talk to any kind of linkage between climate change and asthma?
I can come in here and say that certainly there is some relationship between extremes of weather and the environment, which can affect, trigger persons who have asthma and which can affect respiratory conditions. So not saying that it's increasing the prevalence of asthma, but certainly, and this we have examples right here in the Caribbean. Certainly post Hurricane Maria in Dominica, with the flooding that happened and with silt from the riverbed all through the streets of Dominica, which then dried and left a very fine powdery substance that was affected the air quality quite a lot. You certainly had increased triggers for persons who had asthma, and certainly increased respiratory irritation, disease, and this was reflected in the number of emergency room visits for respiratory condition following the hurricane. So there are extremes in heat and changes in weather have an effect on the air quality, which certainly has effect on respiratory diseases and is a trigger for persons.
Apologies for coming back a second time, but I'm sorry, Dr. Reddy, are you finished or?
Yes, I am.
Dr. Radix has a slight delay, I think.
Okay.
But you can go ahead, Dr. Weech. We can bring her back in if she'd like.
No, thank you very much for that. There are two issues that we are seeing with regards to asthma. One relates to young people who are diagnosed at very young ages as having asthma. And we're also seeing something that's fairly new in the context of, and I'll make the case in point. This is the indoor air pollution. If you go throughout sub-Saharan Africa, where people are using wood-burning stoves, or throughout most of Asia, where you're using wood-burning stoves in enclosed facilities, you have a link between air quality and a direct link to asthma. In the case of what we think we understand about asthma in our own environment, it has to do with the fact that particulate, very fine particulate is being taken into the lungs, and that's creating problems into the future. What is different, and climate change has links to this, is the fact that in the case of what has happened in recent times in the Bahamas related to storm surges and homes being compromised, we're now finding that the issue of indoor air quality becomes quite significant because homes are flooded. And if you don't go through the process, or if you cannot afford to properly desanitize and remove infected carpets, furniture, walls that have black mold, we're now seeing that that is becoming an increased issue of public health concern, because persons now find themselves living in an indoor environment that is particularly hazardous under the fact that this has happened as a consequences of storm surge or an effect of extreme event. And that's something that's new. Again, the issue in terms of identifying these things as a direct link to climate change, I think Melisa can speak to this. This is still science that's evolving as we speak, and the making connections between one and the other is something that's something that needs to be attributed in more scientific basis. Thank you.
I just have one additional comment. This conversation reminds me of the California wildfires. We're currently experiencing many wildfires in California, and already twice this year, the schools in our area have been shut down because of the particulate matter that Dr. Weech just mentioned. And there are increased rates of asthma, particularly among elderly and young children. And wildfires are an extreme weather event that are related to climate change and drought and many other factors. But it's become a reality now in California to have yearly large-scale wildfires.
I'll leave it on you, Dr. Shah, because the next question is for you. It's from Jan, and the question is, how universal is the result that there is some unimodal distribution for disease transmission with respect to other insect vectors besides mosquitoes? Is the existence of the curve due to some universal physiological insect characteristic?
Yeah, I think that the basis of the unimodal curve is really an ecological, physiologic, biologic phenomenon. I think it's not isolated to mosquitoes, but likely if these were evaluated in other disease vectors, my hypothesis is that you would see similar sort of traits. I mean, it's hard to imagine that. Yeah, as you think about temperature increasing, it seems like there has to be, a limit to sort of lower and higher temperatures, and having a unimodal distribution sort of makes sense physiologically. I don't know any specific data about other vectors, but it's an interesting thought.
Yeah, a comment came in on the dust, the asthma comment. This comes in from Tara, so I'll just read it. I think it's a comment more than a question, and it is, what I've noticed personally is that when the air quality is affected by the Sahara dust, my sinus is really bad, my eye is affected. Is this an increasing issue for the country or a concern that needs to be looked into? Okay, so it is more of a question about the dust and its effect on sinuses and other health effects. So is this an increasing issue for the country that needs to be looked into? Maybe I give this one to Satish to create a question.
Thanks, John. And I can recall one of our graduate public health students actually engaged this exact topic in Grenada, but extending beyond into the Caribbean basin as well, where over a 10-year period, an analysis was conducted to demonstrate that as Sahara dust was increasingly measured throughout any given annual year, that also resulted in increased number of accident emergency presentations with asthma. The Caribbean basin has a traditional trajectory of debris dust from the Sahara crossing the Atlantic Ocean into the Caribbean basin. We have the northeast trade winds, and this is traditional. But also, since the Sahara Desert itself is expanding its desertification as the process is increasing, we are also observing greater levels of particulate matter. Now, the particulate matter can be twofold. It can be as a result of the transatlantic voyage, but it can also be particulate matter from within the Caribbean context as well, as we, as small island developing states, continue to explore our land resources and to exacerbate the aspect of dust and debris within our small island states as well. So this is an area that is explored, and it continues to demonstrate that there is a linkage with Sahara dust. In fact, the Tara has a personal experience. And Sahara dust in the Caribbean region is not only an asthma issue, it affects visibility. It affects sometimes even the waste. I mean, there's debris on our vehicle windscreens, in our home windows. So it's a layering effect in our environment as well. So definitely there's a link, and it is increasing over time, and it's also associated with increase in asthma cases and other respiratory distress as well.
Yeah. Okay, so it's 3:15 on the East Coast and in Grenada right now. I think we're going to go to about 3:30. We've got two more questions, but Satish, I've noticed you've had your hand up for a little bit. Was there something you wanted to bring up? And by the way, Dr. Shah had to leave us, so we're left with Dr. Weech and Dr. Radix right now.
So John, what I'm realizing more and more, and I understand the concern that healthcare professionals have in terms of making the direct link between climate change and health, because the link really is indirect, and it requires an exaggerated, extended explanation to sort of like bring these two together. With that in mind as well, I'm also thinking about the whole issue of food. So climate change impacts the environment. It affects agricultural production, which produces food. we have experiences where adverse events leads to drought, leads to flooding that can impact our production and in fact impact our consumption and dietary habits as well. And this aspect can do two things. It can compromise our healthy food consumption, and it can also select for unhealthy food options as well. So it can lead to overnutrition or undernutrition. It can contribute to chronic disease burdens, and it can contribute to immunocompromised conditions to support communicable diseases. So this is another element in which there's a link between climate change and health, but it does require some layering as it relates to how that, in fact, is actually established. So I can appreciate the perspective that climate and health is not necessarily a natural link, but it does require for us to see how best we can package this information, digest, and present these different linkages towards an understanding and building consensus to inform the effort and the attention on this issue as well.
Yeah. You mentioned food supply in there, and there is actually a food supply related question here, so it segues nicely. And I will present this to Dr. Weech first, if Dr. Weech, you have any experience in this. But the question comes from Carlston, and it is, how has rising temperatures affected the food supply, particularly the fishing sector, in terms of reproduction and nutrition to consumers of fish?
Thank you very much. I'm online. That's a question. You're probably asking the wrong country when you ask about food supply and food security. For the Bahamas, virtually 90% of what we consume in the Bahamas is actually imported. We have a very large tourism base, and we do not currently produce enough to feed ourselves and also to feed visitors who are here. So food supply and food security for us is a major issue, but it manifests itself slightly different. The question becomes one of how much foreign exchange do we have at any point in time to be able to purchase the necessary food that we need should we find ourselves in a situation where we have to do so. And the answer is, I think the estimates I saw in some of the recent studies is that we may have at the most enough foreign currency to buy food for 2 to 3 weeks, as opposed to months, years. And we do not grow enough to feed ourselves. And so therefore we're in that situation where food security is a major issue for us.
Yeah, I made the connection between water and fishing, but that's a fair answer. So
yeah,
I'll expand.
Let me answer. Let me go to the water, and then I'm going to go to the fish. Okay.
Sure.
So let me go to the fish first, because I don't know how many of our colleagues are aware of the Hurricane Andrew that took place in 1992, and the fact that the spread of lionfish in the region is directly attributed to the fact that the damage that was wrought in South Florida resulted in the release of a species that is common to the Pacific in the Caribbean, and that's now led to an invasion of an invasive species that is now finding its way and eating its way through the entire Caribbean, including Central America and South America. And this is the lionfish. This is the nice, pretty one that's in John Picard's window, which shows it is a beautiful fish. It's a top predator in the region, and that is now having a significant impact on fish and fish harvesting, as well as it poses risks to persons actually who find themselves envenomated when they actually handle the animal if they were to capture the animal. So there is a link between climate change and it's through the fact that several things are happening. As the earth and the water temperatures warm, fish, like every other species, migrate more to the north. And so some of the studies are indicating that, yes, some of the more commercially viable fish in our region are finding themselves more and more in northern waters. So the fisheries in the Southeast Caribbean that's depending heavily on your marlin, your tuna, and those fishes are finding themselves or will find themselves into more stress in that regard. For the Bahamas, we tend to do more reef fish. We do the larger fish by way of tourists, by way of the big gamers who are coming to catch a large marlin or catch a large tuna. And so it's having different effects. But for food security issues, it's a situation where we depend on imports to deal with that. For water resources, this also becomes increasingly important because today, virtually all of our water is produced by reverse osmosis. The two main islands that still depend heavily on fresh water for public water supplies are the two of the three islands, Grand Bahama and Abaco, was particularly decimated by the storm surge that went across the islands. Andros is the other island for which all the water being supplied is from groundwater resources, and that was affected by Hurricane Matthew and Hurricane Joaquin, some of the issues throughout the entire Bahamas. So water resources is being affected by storm surge and inundation, where you have a flat landscape for which seawater then intrudes inland and then salinate water resources for quite some time. The studies that we have seen and that we've worked on is indicating that it can take anywhere from 6 to 8 months or 2 to 3 years for the water quality to revert to being potable. So for example, in Grand Bahama at the moment, all of the water supply is being pumped very heavily because we're trying to reduce the salinity so the system reestablishes itself as a freshwater resources. But the water quality now is orders of magnitude higher by WHO standards, where we set a limit of 200 parts per million chloride or lower. We're still having waters being pumped into 700 to 800 parts per million chloride, and that's by virtue of the fact that salt water is now slowly making its way through the freshwater reserves. Thank you.
Thank you. So we have one last question, and then I'll turn over to Satish to close out the session. But the last question I'll present to Dr. Radix first. It is, are African countries ready to face the increase in the incidence of arbovirus diseases? Did you hear the question?
Yes, I heard the question. Are you hearing me?
Yes, so there's a slight delay, but yeah, you're good. Go ahead.
Okay. So I don't think I'm necessarily qualified to answer the question about whether African countries are ready to respond to the increase in arboviruses. I think Dr. Shah was probably better placed there. Yeah. But if I go back to the issues of health systems and health system resilience, the fact that outbreaks as well as the catastrophic effects of extreme weather events, whether it be flooding, droughts, etc., put stress on our health systems in Africa, health systems in the Caribbean is certainly something that's widely considered and of concern. Health systems that already may have challenges with regards to human resources, financial resources, and other resources, low resource settings, obviously have less capacity to expand and absorb the shock when we have outbreaks of this nature. So certainly I would think that this is of concern, and it's the reason why we need to look at systems and find ways to be able to provide that surge, whether it be financially, by human resource, etc., when these shocks occur, and also create systems that are able to adapt more quickly in terms of how they work, because new things, systems need to be able to adapt quickly. So having the sort of decision-making and adaptable systems in place are needed for health systems.
Yeah, fair answer. Despite not having direct experience there, that was great. There was a last minute Caribbean question that came in, so I'll present this question to you as the last question. So fairly short, 3-minute answer, and then we'll hand it over to Satish. But the question comes from Magdalene, and it is: the upsurge of sargassum in Caribbean waters has been blamed on climate change. What are the health implications?
So that's an excellent question. And we're beginning to learn and be concerned about what the health implications are of sargassum. As a matter of fact, just last week, there was a conference held, an international conference held in Guadeloupe around sargassum with experts from throughout the region, looking at how we can battle this issue. But in terms of health effects, what we do know is that hydrogen sulfide is emitted from the seaweed, and what we don't know or what we're not familiar with is what are really the effects. What are the acute effects and what, if any, are the long-term effects? Because the quantities of sargassum that we're seeing now and that associated with what we do to get rid of it, the way in which we bundle it, pile it up in spaces that may have persons exposed to it, etc., we're not familiar with how this affects human health. And so one of the things we need to begin to do is to measure the off-gassing from sargassum and to begin to try to understand what the effects are. But we certainly remain vigilant and concerned. I don't know if Satish has anything to add to that.
Thank you very much, Carlene. And certainly we share with the respiratory distress. We also share with the fact that the sargassum is affecting our economic coastlines, especially as it relates to our tourism product. And also people reside in coastlines. And besides the respiratory distress, fishermen are affected. It's a whole social issue involved, and it's one of the examples of how physical, mental, and social so it sort of comes together as a health issue as well. And in any health issue that we discuss today, and will really back to climate change, it's always a matter of a physical health issue, a mental health issue, a social health issue as well. So sargassum seaweed, it's increasing. We have been experiencing this now for maybe about 4 years in terms of our upside, certainly. And we are finding innovative ways as well to even respond to it. Persons are creating even fertilizers as a product out of the sargassum seaweed. So there are innovative ways in which we can manage the issue, but certainly the health implication does exist. And the upsurge comes from the Atlantic Ocean, and the prevention and control resides in the sargassum sea, where it's sourced. And what are the factors, what are the opportunities that are presented at that sea for sargassum seaweed itself to grow exponentially and to allow it to enter and beach itself into the Caribbean shorelines. So it's a complicated issue. And as Carlene mentioned, the Caribbean is taking stock and having conferences and discussions on it. But it does have health implications, it does have social implications, economic implications as well for the region.
So I think we've hit our time. I'll thank Dr. Weech, Dr. Radix for joining us, and Dr. Shah, who joined us as well and left about 15 minutes ago. And I'll turn over to you, Satish, to close out the session.
Thank you very much, John. Thank you very much. And we look forward to hearing you return to your normal voice as you recover from your flu in our next session, next week in our third week. And speaking about as we transition from week 2 to week 3, today and for week 2, we focus on health. In week 1, we discuss climatic determinants. Now is the time for us to move towards action. What are policies? What are practices to mitigate the effects of climate change on our health? So in week 3, we will be sharing with other colleagues and persons who are at the policy level at the World Health Organization, at the United Nations, to share with us what are the ongoing, what are the projected plans as it relates to responding to the factors, the determinants of climate change. But before we get to week 3, we complete week 2. And the activity, in addition to this seminar for week 2, is bearing in mind the old adage that a picture paints 1,000 words. So we would like you to search for a photo that depicts a climate-related health risk factor And you need to describe what your picture depicts in terms of what disease that risk factor is associated with. So even today, we discuss mosquitoes. Mosquito, in terms of breathing, water collection, can be a risk factor that can contribute towards arthropod-borne viruses. We spoke about the issue of even the lionfish as an invasive species for our Caribbean ecosystem and the implications that have for food supply, food safety, and the nutrition and the dietary implications that have as well. So we encourage you to consider an image which depicts a climate-related health risk of your interest, and then describe that image and the disease or the health issues that ensues as a result of that risk factor. Thank you very much for joining us once again. We look forward to continuing the activity in our discussion forum and appreciate the opportunity of our panel and our colleagues to share in their expertise and experiences with us this week. And see you guys in week 3 for our open access course, Climate and Health, as part of our One Health, One Medicine course series offered by St. George's University. Thank you very much and goodbye for now.
Thank you and good day to all.
Thank you so much. Bye-bye.
Thank you. Bye.